All right, let's get right into it. The opioid crisis is constantly in the news, and usually the story we hear is pretty simple. But today, we're going to peel back the layers on that story. We're going to deconstruct the incredibly complex system behind what's become one of the most devastating public health crises of our time. You've heard this a million times, right? Some version of this statement. It's the simple go-to explanation that points a finger at traffickers and drugs coming across the border. It's direct, it's easy to grasp, and honestly, it shapes a lot of how we think about this problem. But is it really that straightforward? As we're about to see, that simple statement, that easy answer, well, it hides a much more complex and, frankly, a much more disturbing reality. So let's treat that common quote like what it is, a misleading headline, and right now we're going to break it down piece by piece and see exactly why it doesn't even begin to tell the real story. First things first, let's get our facts straight on fentanyl. This idea that it's a drug of choice for criminals, that's not quite right. For the traffickers, this is purely a business decision. Fentanyl is incredibly cheap to make, and it's so potent that a tiny, tiny amount goes a very long way. That means massive profits. They use it because it's good for the bottom line, plain and simple. A lot of the time, the end user has no idea it's even been mixed into what they're taking. So if the story isn't just, it comes from Mexico, then what's the real journey? Let's actually trace the global path this drug takes before it ever shows up on our streets. You can see right here, this thing is global. It all starts with what are often legal chemicals, the building blocks, many of them sourced from China. Then they get shipped to Mexico, where cartels run these sophisticated labs to actually manufacture the fentanyl. From there, it's trafficked into the US through all sorts of complex routes, and only then does it hit the streets. It's a full-blown, multi-stage international business operation. Okay, so that's the supply chain. That's the what and the how. But here's the question that changes everything. Why? Why does this massive illicit industry even exist? It's because there's this huge pre-existing demand for opioids in the United States. And where that came from? Well, that's the real story. And that brings us to the corporations. Because the foundation for this entire crisis wasn't laid by cartels in Mexico. No. It was built completely legally in corporate boardrooms right here in the US. You really have three main sectors that profited by creating and then feeding this demand. First up, the manufacturers. They created these powerful opioids and then marketed them aggressively, all while seriously downplaying the risks of addiction. Then you've got the distributors, the middlemen, who shipped just unbelievable quantities of these pills all over the country, often turning a blind eye to obvious red flags. And finally, the big retail pharmacies that were dispensing them to people at a scale we'd never seen before. And look, we're not talking about some shadowy, unknown companies here. These are household names. Manufacturers like Purdue Pharma and Johnson & Johnson, the big three distributors, McKesson, Cardinal Health, and AmerisourceBergen, and yeah, giant pharmacy chains you see on every corner like CVS, Walgreens, and Walmart. The scale of this is it's staggering. Take a look at this number. Over $21 billion. That's not total profit. That's just the settlement amount that those three distributors alone had to pay for their role. It just gives you a tiny glimpse of the insane amount of money that was being made. So here's the absolute key takeaway, the root insight of this whole mess. The massive demand for opioids that the cartels are now exploiting, it wasn't an accident. It didn't just happen. It was systematically engineered over years of aggressive marketing and a supply chain that flooded our communities with billions of addictive pills. So when you finally see both parts of the equation, the engineered demand and the illicit supply, it becomes crystal clear why so many of our efforts to stop this crisis have been failing. We've been busy chasing the symptoms instead of going after the root cause.
Think about it. The tactical approach, the one we see all the time, is about intercepting a small boat here or an individual shipment there. It feels like we're doing something, but it's like trying to empty the ocean with a bucket. The trafficking networks just adapt and find a new route. A strategic approach, on the other hand, goes after the system itself. It means targeting those precursor chemicals before they can even be turned into fentanyl. It means going after the money laundering networks that make the whole operation profitable in the first place. Which, leads to a pretty interesting thought experiment. If we could just ignore all the politics, the bureaucracy, the red tape, and just design the single most efficient way to shut down this entire system, what would that actually look like? Let's just imagine for a second an artificial superintelligence, or an ASI.
tasked with solving this crisis. The big advantage it has, it can see and act on the entire global system all at once, like hitting a systemic kill switch. So in the very first hour, bam, it maps the entire global network in real time. Within the next few hours, it's already disabling the key choke points, stopping the chemical shipments, taking the labs offline. By hour 12, the money's gone. Financial lifelines are completely severed. And then, and this part is absolutely crucial, in the second half of the day, it pivots to stabilize demand by flooding the zone with access to treatment and overdose reversal drugs. It attacks supply and demand at the exact same time. Look, this thought experiment isn't really about AI. It's about strategy. It just shows us that a real, effective solution has to be comprehensive, it has to be coordinated, and it has to happen all at once. It means we have to attack the root causes, not just the symptoms we see on the news. So the final question really isn't about if we can solve this crisis. The question is, what's stopping us? What are the human systems, the lack of coordination, the competing interests, the bureaucracy, that are preventing us from tackling this problem as a whole?